Okay. Hello, my name is Miriam Martinez. I'm an FNP student, and today I will be performing a neuro and a musculoskeletal exam. I will be starting by assessing my patient's mental status. She is Spanish speaking, so I will be asking her everything in Spanish. ¿Me puedes dar tu nombre completo y fecha de nacimiento?
Mayra de la O, noviembre 14 del 76,
Okay. ¿Me puedes decir dónde estamos ahorita?
en El Paso, Texas.
Okay. So she was able to tell me her name, date of birth, and where we're at. I will be assessing her short-term and long-term memory now. It's going to be very simple questions just for this video purposes. ¿Me puedes decir qué almorzaste esta mañana?
Menudo.
Okay. And then I'm going to ask her for long-term. ¿Qué hiciste el año pasado, el 25 de diciembre?
Creo que tamales.
Okay.
Tamales, sí. Tamales verdes y rojos.
Okay, so she was able to remember what she did last year, which assesses good long-term memory and short-term memory. I will be assessing calculations to see how her processing works. I will be asking her to say the numbers starting at 100 and then subtract by 7. So si me puedes decir del número al 100 y luego subtractando 7 cada número.
100, 99, 98, 96.
No, subtractando 7.
Ah,
100 menos 7 y luego.
Ok. Son 93 y luego le quito otro 7. 80 y... ¿qué son? 86. 86. 79. 72. 72, 50 y 65, 57 y los 50, ¿sí?
Okay. And that would be the part of it. Usually you do want her to go all the way to 0, but she did very good for this part. She did have a little struggles, but she was able to come back and start subtracting by 7 again. I will be assessing abstract reasoning. I will be asking her a simple question. ¿En qué se parecen las manzanas y las naranjas?
Que son frutas, son redondas.
Okay, so she did say that they were fruit, which does show that she does know, she's able to do some abstract reasoning. If she were to say if it was from a tree, it could be a concrete reasoning there. What else? But no, she is alert-oriented times 3. She has very good comprehension. Now I will be going and assessing her musculoskeletal, and at the same time I will be assessing her neuro exam as I'm assessing all her muscles. So first thing, I will be assessing her shoulders just to see from my point of view they look nice and symmetric. I will be inspecting, making sure that there are no deformities, swelling, or any deformities, abnormal positioning. I will be assessing range of motion, so I will be asking her to assess, so I can assess flexion, extension, abduction, adduction. So for flexion, I will be asking her to raise her arm. So me puedes levantar tu mano hacia arriba de la cabeza. A toda derecha, okay. And then at the same time, I'll be assessing neuro, so bajar otra vez. Y ahora trata de hacerlo contra mi fuerza de la mano. Okay, so good. Puedes hacer la otra. Okay. Now for extension, if she could, now I'm gonna be asking her to put her arm back. So si puedes estirar tu mano hacia atrás, o te puedes levantar si quieres. Okay, perfecto. Te puedes sentar otra vez. And for abduction, so ahora tus manos, si las puedes retirar fuera de tu cuerpo, y luego ahora hacia adentro de tu cuerpo. That's abduction and adduction. And then for internal and external rotation, si puedes, cualquier mano, si la puedes poner atrás de tu espalda y tratar de tocar tu hombro. Okay, so I'm looking back and I see that she has good internal rotation. For external, si puedes levantar tu mano hacia la misma nivel de tu hombro, dóblala y luego la haces para frente y para atrás. Okay, so that is external rotation, perfect. So she has very good range of motion. Muscle strength that I was able to assess from the shoulder abduction was 5. She has very good strength. Now I'm gonna skip over to the elbows, and from the shoulder I could tell she was not in pain, no discomfort noted. Now for elbows, I will be assessing, making sure the same thing, that there's no deformities. Assessing her olecranon process for nodules or swelling, which I don't know any. Perfect. I will be now assessing for the same range of motion, which is flexion, extension, pronation, and supination. So si puedes estirar tus brazos. Nomás así para hacer. Y luego si los puedes doblar hacia tu cuerpo. Okay, para otra vez. And then now I'm going to be assessing for muscle strength. Okay, muy bien. Now for supination, igual tus manos estiradas y nomás rotarlas hacia arriba, hacia abajo. Okay, perfect. So I don't see, she has very good muscle strength, no pain was noted, very good range of motion. For wrist and hand, I will be skipping. I will be assessing her fingers, her wrist, to see that there's the same thing, no deformities, no pain, no crepitus noted. Okay, perfect. No atrophy noted. I will be assessing for her the same range of motion, which is extension and flexion. So I'm gonna have her make a ball on her wrist, sorry. Y luego si puedes levantarles hacia. Perfecto. Ahora contra mis fuerzas. Okay. Muy bien. The same for her fingers. Si puedes estirar tus manos y ahora también hacia abajo, hacia abajo, hacia arriba. Okay, otra vez también la fuerza. Muy bien. For fingers, now I'm going to assess for abduction and adduction. So nomás con dos. Si puedes separarlos y traerlos juntos otra vez. Y contra fuerza. Okay. Contra la fuerza. Okay, muy bien. For thumb, also to assess for thumb mobility. So me prestas tu mano. Y luego si puedes poner tu mano en un puño y levantar tu dedo, tu pulgar. Bien. Y contra fuerza. Okay, perfect. So here I was able to assess for finger, wrist, and thumb's flexion and extension for full range of motion. I was also able to assess for muscle strength, no discomfort noted. She has very good muscle strength and range of motion, full range of motion. Now I will be going into assessing her her spine for assessing a flexion, extension. So I will be asking her to see if she can bring her chin to her chest. So si puedes poner tu mandíbula hacia tu pecho. Okay. And I will be taking this time to also assess her neck. Nice, and that is very symmetric. No pain noted when she did that. Ahora sí puedes ver hacia el techo. Okay, so that's good range of motion. She's able to move her head up and down. Now to assess for rotation and lateral bending, I will be asking her to see if she can look over her shoulders. So si puedes voltear tu cabeza y ver hacia tus hombros. Ok, muy bien. Y ahora sí puedes tratar de traer tu oído hacia tu hombro. Hacia el otro ahora. Okay, so this is assessing for lateral bending and rotation, which is good range of motion. Didn't seem like she was in discomfort. It was very symmetric. No, her foot is noted. For hips, I will be asking her if she can stand up. Si te puedes parar. So at first, when I look at her, I make sure that she's standing nice and straight, that she's not really moving around. I will be asking her to see if she can bend forward. Si te puedes tratar de tocar los pies hasta donde puedas. Okay. So spine looks very symmetric from this side. No wiggling noted. So si te puedes parar otra vez. Y luego si te puedes tratar de recargar lo más para atrás que puedes. Okay, so this is assessing for extension. Ahí está bien. Now I will be checking to see for rotation. So le voy a decir que I'm going to ask her to rotate her hips. So si te puedes vez al otro lado. Okay, good rotation noted. And now for lateral bending, si te puedes tratar de ir hacia un lado y tratar de tocar con tus manos las rodillas. Okay, muy bien. So this is lateral bending. And no abnormality noted. She didn't seem to be in any sort of discomfort or pain or any atrophy, nothing noted. And usually she would be asked to be wearing shorts, so I could really assess her knees to see if she had any bruising or deformities. So I will ask her to sit down again, si te puedes sentar. And like I said, she would be wearing shorts, so I would be able to assess her knees. I can just touch them. No deformities noted. Everything seems to be symmetric in place. Okay. And I'll be asking her to lay down, but we'll be assessing her knee for flexion. So, si puedes doblar tu rodilla, okay, y luego estirarla. Oh, sorry. Okay, so she's able to flex and extend her knee. I will be asking her to lay down. Si te puedes acostar hacia cualquier lado, en tu espalda. Okay. So, I will be checking for also hip mobility, which I skip. So I'll be asking her to bring her chest towards her knee, towards her chest. Puedes traer tu rodilla hacia tu pecho, lo más que puedas. Una a la vez está bien. Okay. Hacia afuera ahora. Hacia afuera, no hacia afuera. Okay. Muy bien. So then now I'm gonna see for abduction. So si puedes poner la pierna derecha está bien, hacia afuera de tu cuerpo, derecha, y lo hacia adentro de tu cuerpo. Muy bien, so this is assessing for abduction and adduction. So now I'm gonna help her to assess for external rotation. So si puedes doblar tu rodilla, and I will be rotating it inward, ¿te duele? Okay, and outward. Okay, so this is for internal and external rotation. It was well at midline, no deformity noted, no pain. I asked her, she said she was not having any pain. Okay. And we'll be assessing her ankles and feet. I will be wearing gloves for this. So I'm gonna be assessing to make sure there's no deformities, no swelling, nodules, no calluses. Okay. I will be asking her to flex, so plantar flexion and extension. So I will be asking her to try to bring her foot towards her body. Si puedes, ok. Ahora hacia afuera. Y ahora sí puedes ponerlos mover tus pies hacia adentro y hacia afuera. Ok. So I was able to assess for flexion, extension, inversion, and eversion, which she had really good range of motion. No ignore, like I had said earlier, for all the other systems I assessed. I did forget to assess for motor strength, so si puedes traerlos hacia dentro, okay, muy bien. And then for her knee, I will be, okay. For hip flexion, I would ask her to bring her right leg up against my core. So si puedes levantar tu pierna, okay, muy bien. Ahora sí lo puedes doblar y traer hacia tu pecho contra mi fuerza. Okay, muy bien. So assessing from good muscle strength. No pain, no deformities noted again. I think I covered all the muscle strengths and range of motion. I will be asking her to stand up, si te puedes parar, and I will be assessing her gait. So I will be asking her to give 5 steps forward. Si puedes caminar hacia enfrente, ahora hacia
Frente.
y luego atrás. Okay. Ahora de puntitas, not toes, walking. Okay. Y ahora de talón, so now on her heels to walk. Okay. Muy bien. Now that she's standing up, I'll be asking her to do some rapid alternating movements. So si puedes repetir lo mismo que yo hago. Okay. So she's able to do that. Si puedes, so I'm gonna ask her to tap her fingers now. Okay, muy bien. Now that she's standing, I'm gonna ask her to do some finger to nose. So puedes estirar tus manos y ahora trae tu dedos a tu nariz. Ahora la otra. Okay. And I'll be asking her to do the heel to chin. So si puedes traer tu talón hacia arriba de tu pierna. Si la puedes poner a través de tu pierna así.
¿Sí?
Bajarlo así con el talón. Okay. Ahora con la otra. Okay, so good heel to chin. For gait, I saw that I had her walk at a good gait. No, she wasn't walking from side to side. She was on a steady, straight gait. I will be assessing for the Romberg test, so I will ask her to stay the way she is with her feet together, and then if she can close her eyes, se puede cerrar tus ojos. Okay, so I will be doing this for about 20 to 30 seconds to see how she does. A little bit of moving is normal. If she falls, she could have some neurological problems, so I would ask her to stop. Ya paramos. Okay. So she did really good assessing coordination. She was nice and straight. She was able to follow commands, everything I told her. I will now ask her to sit down. Si te quieres sentar. Okay. And now I will be assessing her sensory muscles. So for this, I would usually use a reflex hammer, but I do not have one, so we would be mimicking like this is my reflex hammer. I will be assessing, for doing this, I would be assessing the bicep reflex. The way I would do it, I would ask her to lend me her arm. I would put my finger right on her elbow, and with the reflex hammer, I would tap it, and in a positive illicit response, she would move her arm towards her. But since I don't have one, I'm not very able to assess it properly. Now for the tricep, we would be doing it, I would be holding her arm like this. I would be doing the reflex hammer right on her elbow, right here, and I would be tapping it. Positive elicit, she would be moving her arm towards her body. To assist for the brachioradialis reflex, I would be holding her arm, and right on her radial, I would be tapping it with the reflex hammer, and the same thing in this is she would be moving her arm towards her. To assist for the quadriceps and patellar reflex, with the reflex hammer, I would go right under on her knee, and when I tap it, what it would elicit her leg moving forward. It would happen the same on both. For the Achilles, I would go on the back on her ankle, and it would elicit the same response. If I tap it, her leg would move forward. I would be assessing now her plantar response. So what I would do with the pen would work. I would ask her to raise her legs, lo levanta, and on the side on her plantar foot, I would rub it. So this is a negative sign, a good sign. Her toes should be staying the way they are. If her toes open up, that could be abnormal response. It could be a positive sign for Babinski's. So that would suggest a neurological issue, but hers was normal. And then for abdominal reflex, I would ask her to lay down. Si te puedes acostar una vez más. And with the same thing, I would levanta la blusa. And then on her stomach, I would just rub my reflex hammer towards her center of her abdomen, and I would see her abdominal muscles contract inward to the centered midline. Okay, so that would complete this part of the neurological and musculoskeletal exam. Throughout the exam, I was able to notice that she had a 5+ strength on all her muscles that I assessed, and she had really good range of motion, appropriate range of motion, and that would complete my exam.